Ladies and gentlemen, please welcome Edgar Ruiz, Executive Director of the Council of State Governments West.
Good afternoon, everybody, and thank you all for being here. I want to also thank all of the partners and sponsors that have made this summit a great success. And not only the bringing together of all the folks in the criminal justice and mental health area, as well as the sharing of best practices and information, and also just some wonderful speakers. So thank you very much. One of the unique features of the Council of State Governments is that it's both a regionally based national organization. As such, state lawmakers and policymakers are able to engage at a national level on programs like the Justice Center, but also engage at a regional level. Our office covering the western region of the United States is based here in Sacramento, and I want to know that it's a resource to all of you, and we welcome your engagement and participation in our programs. We work very closely with the Justice Center. Among the projects that we work collaboratively is on our Public Safety Committee that brings together legislators from our 13 western states to address issues of reentry, mental health, and others that are affecting all of our states. It gives me great pleasure today to introduce two great champions in the California legislature that have been at the forefront of getting the state to respond to the challenges of mental health. And I'll begin first with Senator Jim Beall. He represents District 15, which encompasses the Silicon Valley area. He has over 3 decades of experience serving as a council member for the city of San Jose in the Santa Clara County Board of Supervisors, 6 years in the Assembly, and now in his 6th year in the State Senate. He is the chair of the Select Committee on Mental Health, as well as the chair of the Senate Mental Health Caucus. He has been involved in the delivery of mental health services for California, including the passage of laws to increase enforcement of mental health parity laws. Also in 2015, he authored a bill that became law that drastically improved the mental health training for peace officers in the state of California. So we welcome Senator Jim Beall. And joining him as well in the here in the roster will be Senator Nancy Skinner, and she represents Senate District number 9, which includes Alameda and Contra Costa counties and cities. She too also served at a local level, serving in the Berkeley City Council, previously 6 years in the State Assembly, and now just recently elected to the State Senate. She is the chair of the Senate Public Safety Committee, as well as chair of the Senate Budget Subcommittee 5, which on corrections, public safety, and the judiciary. She's also been named as part of the leadership team as Majority Whip, and she's focused on reducing the number of juveniles incarcerated in the state facilities as part of her time at the legislature. She's also been working on establishing new and dedicated funds to reduce prison recidivism. So with that, please help me welcome Senator Skinner. And now Senator Beall. Thank you.
Thank you. It's wonderful to be here at the Stepping Up Initiative, and it's great to see some of my, I won't say old friends, I mean, that's not right. But from my service as a county supervisor for 12 years and working with county officials as a county board of supervisors before I became a legislator. I got only like 4 years and 2 months as a senator, so I'm not 6 years. So I got 4 more years, okay? Nancy was teasing me about it. I'm going to be working as a partner with Nancy on a lot of this issue, as you'll probably hear from her later, but we're going to be the team tag team on a lot of these mental health and criminal justice issues. So it's great to be here. I want to give a shout out to Judge Manley, who back in when was it, Judge? 96? We started, he came to me, he said, you know, with Judge Terry, right? We said, when I was chairman of the Board of Supervisors, he said, well, we did a special court for mental illness. And he says, I got the thing, I just need the money. How many county supervisors are familiar with that, right? They come up and they say, well, we just need the money. Well, we got them the money. So we started the program, and ever since then we've had the mental health courts. And it's important that we take those first steps, right? So that's what I'm going to talk to you about today, because I think it's very important to take those first steps in your Stepping Up initiative. And sometimes it's hard to take steps, the new steps, and change things and create change. But I think for us, for too long we've maintained a crisis-oriented system. Crisis-oriented means we've neglected prevention and care. We kind of have a system that doesn't respond well to prevention and care. And of course, we see that when we have all the people that go to the state prisons, and we have the court receiver, all those kinds of impositions that tell us what to do. It's very difficult to operate an efficient system when you have all that kind of thing happening. So what I would like to see over the next 4 years, is I'd like to see us get out from under the court receiver. I'd like to see us run an efficient system, and I think we ought to think about reinventing how we do business. Are you with me? Let's do it. Let's make it work. So, time to recognize failure when we see it, you know. I mean, people with mental illness often receive no treatment until they end up in the justice system. There's a problem there. And a third of the inmates suffered from serious mental illness. So probably 80% have some form of mental illness, right? Not only is this unfair to those who are suffering, the status quo is costly, ineffective, and dangerous. And, you know, California voters have had 3 separate propositions that have passed that tell us to change. You know, we got the message 3 times. So I'm introducing 3 bills this year with some of the goals that we have. SB 8, this will provide the courts with an option for pretrial diversion for defendants with low-level offenses as a result of their mental illness. SB 142 will ensure a defendant's history of mental illness is considered during sentencing, incentivize counties to provide a more community-based treatment. And 143 will ensure fair treatment for Californians in state hospitals on who should be eligible for resentencing under the 2 propositions passed by the voters, 36 and 47. Now, I welcome your feedback for those ideas. There are a lot of reasons right now to feel hopeful, even though we're having all this turmoil in the healthcare system and so forth. We want to continue our dialogue. And we're all worried about losing healthcare and all those kinds of issues, vulnerable members of our communities. I'm worried, but I'm hopeful about this particular issue we're talking about. So we have opportunities to find agreement. Let's take the step forward, and I thank you for being here to work on this issue. Thank you.
Good afternoon. I'm really pleased to have been invited to join you, and what I really want to do is thank you for coming together. That, as my understanding, is some 52 of California's counties registered for this event, and that what we've had gathered yesterday and today are county leaders, California county leaders, from our county administration, our Board of Supes, our jail, probation, health, and court divisions all coming together to discuss this extraordinarily important subject and very critical need. And as you have all just been discussing for the last 2 days, but my colleague Senator Beall mentioned, we are tragically in a situation where California, and we're not unique, we're not the only state in this circumstance, is using our jails and our prisons as mental health institutions. That is not what their purpose was. It is not what they were designed for, and they basically don't do it well. And that's not to be critical of our jails or prisons. It is to just acknowledge that it was not their role. So I am really, really glad that, and I know that this is not the first time this subject's been discussed, but the fact that such a diversity of the different divisions and counties that have to deal with this problem have come together, and that the Stepping Up initiative is really trying to think about how we move forward, what are appropriate adjustments, interventions, changes, whatever it is, right? And I will tell you that I am not an expert in this area of mental health, and I will be looking to you to partner on how do we move forward correctly. I, like almost everyone in this room, have had I have family members with mental health issues. I have family members with who have dealt with our criminal justice system. And of course, if I look at my own district in Contra Costa and Alameda County, I've got one of the largest reentry populations, and because of the cost of housing in our area, one of the larger increasing numbers of homelessness. But many other counties are facing the same thing. And I bring up homelessness because and the housing crisis, because as you all know, that's adding an additional pressure to this whole circumstance, in that very often we end up criminalizing homeless, not because we're inhumane, but for a whole variety of reasons, because we don't have housing for those homeless folks. And additionally, as the housing pressures continue and we have more homeless, if you did not already have a mental health issue, you do not have to be on the street for long before you develop one. So these are all things that we are grappling with. And I can say I've had either the great fortune or misfortune to be named both the chair of the Budget Subcommittee on Corrections and Public Safety and Judiciary, of which, as Senator Beall mentioned, he's one of my stalwarts. We only have 3 people on the committee, which is great, because when you have a small number, you can be nimble. But we oversee the Department of State Hospitals, CDCR, the courts, and the Board of State and Community Corrections budgets. So again, if there's places to make some adjustments, we welcome your input on that. But then additionally, I also chair the Public Safety Policy Committee, which deals with all the bills that will impact people with mental illness in our jails. It will come through that committee. So it puts me in a catbird seat to assist in making sure that this issue is dealt with in a comprehensive way. And again, I look forward to your recommendations. And I look forward to the day where we are no longer in a circumstance where we are using our jails or our prisons as our mental health facilities. And I stand with you as a partner in that. And I look forward to working with you. Thank you.
Ladies and gentlemen, please welcome Richard Cho.
Thank you. I was hoping I didn't have to dance to the music. Good afternoon. Thank you, Senators, very much for your remarks. I'm Richard Cho. I'm the director of our Behavioral Health Division at the Council of State Governments Justice Center. I'm very pleased and honored to be here. I left my job in Washington in April of 2016, so last year, and in the 9 months that I've been here, I've had the chance to travel to a lot of different states who themselves have stepped up to join the Stepping Up initiative. States everywhere from Arkansas to Pennsylvania, North Carolina to Texas. And I don't want to compare states from one to the next, but I have to admit that the level of commitment and energy that I've seen in this room over the past day and a half is really, truly impressive. I don't know how many states would have a bunch of leaders sitting in a room listening to a session on data and information sharing and HIPAA and 42 CFR. So that in itself is something you should be proud of. And let it be known that it's not just me that is witnessing the level of commitment and energy here today. We've been live streaming this event, and I've been told that over 1,000 people across the country have been following this event on live stream and Facebook Live, which is, I think, very impressive. This event, I think, is demonstrating not only the commitment and the momentum that you have statewide here, but really is kicking off momentum nationally as well. And I think that's what these events are really intended to do, is to really catalyze that momentum. But we also know that it's not an event alone or even an effort over the course of a year that's going to solve this problem. I think it was Sheriff Hutchins yesterday who said, 30 years ago she saw this crisis of mental health in our jails, and yet we're still here today and the problem's only got worse. And it's going to take a multi-year effort for us to get out of it. And this initiative is really about calling on all of us to not let this crisis persist for another 30 years, but really put the concerted effort, attention, and focus on really solving this problem, and I think that all starts with the commitment of leadership. So I have the honor and pleasure of introducing many of the leaders of the organizations that helped put together this event, who will speak to their thoughts on how to continue this momentum. First, we'll hear from Santa Barbara County Sheriff Brown, who's also representing California State Sheriff's Association. We'll have the president of the Chief Probation Officers of California and Napa County Chief Probation Officer Mary Butler. We'll also hear from the Shasta County Adult Services Director, Dean Shrew, who's representing the County Behavioral Health Directors Association of California. And last but certainly not least, the California State Association of Counties Second Vice President and Humboldt County Supervisor, Virginia Bass. So I'm going to turn it over to Sheriff Brown.
Thank you very much, Richard, and thank all of you for your enthusiasm and staying the course till the end of this conference. I really must say that of many conferences that I've attended, this one is distinctive in terms of the extraordinary energy and commitment and the attendance that is so impressive from across our state. And I want to just start my remarks by asking all of you to thank publicly Richard Cho, Mike Thompson, Haiti Fattertoe, and all of the staff from the Council of State Governments who have worked so hard to put this on today. It's very clear that reducing the prevalence of people with mental illness in jails is an issue that's critically important, not only in our state, but across the country. And we, the leaders of your associations, want to support this work and to help address the needs that have been identified in this conference. And towards that end, and recognizing the importance of a collaborative approach, we are committed to formalizing the partnership that went into planning this summit. The purpose of this partnership will be to help counties meaningfully advance the framework that we've identified at this summit. And as a part of this, we will be looking for counties which want to serve as centers of innovation and learning sites for their peers in any of the areas that we have explored at the summit. The Council on State Governments Justice Center will also be looking for other ways to help counties through training and technical support. And in conjunction with CSG, our associations will be reaching out to state entities such as the Board of State and Community Corrections and COMEO to partner in this work. Our goal is to develop the necessary infrastructure, in other words, a home, and the appropriate staffing and other resources to support this work by the beginning of the 2017-18 fiscal year. And in the meantime, over the next 6 months, we will develop targeted efforts to provide assistance in a few of the key areas discussed over the past 2 days. We'll also be soliciting feedback after the summit, and we ask you to please use this chance to let us know your priorities of where assistance would be most helpful. There are some other exciting things that are in the works right now. As mentioned before, I am privileged to sit on the Mental Health Services Oversight and Accountability Commission, and it's very obvious from our executive director's enthusiasm and my fellow commissioners that there's a desire for the MHSOAC to play a role in this as well. And we have discussed and are discussing the possibility of partnering with some of California's leading computer and software companies to better help us gather and manage data and analyze data. And I think there's a prime opportunity for us to take that thought and to maybe look at partnering with them to possibly establish a statewide template or a statewide model that we could use that could capture data at the point of entry that would be available not only to us to analyze locally, but also on the state level as well. We're also discussing the possibility of having a follow-up summit, just like this, probably around the same time next year, to be able to come together and share some of our successes that we will have no doubt achieved by that time, and also to encourage those who are going to be transitioning into our positions to do the same, and to strategize to that effect, and also to strengthen our relationships, the relationships that I think have really been strengthened already on the local and the state level by attendance at this marvelous summit. I do want to say a word on funding issues, because obviously money and funding is the lifeblood of making positive changes in many respects. And there are things that we can do around the edges, and there are things that we can do without it. But the reality is, to effect positive change, we're going to have financial resources to be able to do that. And with all due respect and deference to Diane Cummings, who was here yesterday, who suggested that the money to do this could come from savings that could be achieved from the sheriff's budgets by way of reducing the number of prisoners in our jails, I would just say that the reality is that that's about as close to being able to fund what we need to do as the state's marginal cost savings was in completely funding the impact of AB 109 on our counties. It has no real relationship and bearing to what the true cost and effort is. And I don't think we're ready in the California State Sheriff's Association, and perhaps in our other associations, to let the state off the hook quite that easily. I think that the reality is that counties are a subdivision of the state of California. And we are dealing here with an issue that is, in large part, has been thrust upon us as a result of state deinstitutionalization that took place many years ago. And as a result of that, I think the state still has a role to play in our assuming this new role, or this expanded role, in terms of a change in how we deal with the mentally ill. And I think it has an obligation to step up and help us fund that endeavor as well. And we'll be having some discussions over the next year with the state on just that matter. So let me close by saying that we have many challenges ahead of us, but there will also be many opportunities as well. And let us commit to doing our best to use those opportunities to enhance public safety by building systems of care with large doses of compassion and understanding for those who struggle with mental illness in our communities. Thank you.
I want to thank you for allowing me to have a few minutes just to, in some ways, echo what the sheriff has already said, but to also just say a little bit about the Chief Probation Officers of California and our support of this project. You know, when the chiefs are back home in their counties, We spend much of our time talking about our mission of helping keeping communities safe and rehabilitating offenders. And this fits so much into our mission as we talk about working with the mentally ill who are involved in the criminal justice system, and in particular those who are in custody and incarcerated throughout the state, and looking at how we do reentry. So this really is a perfect fit for us. I would just like to remind everybody that when this summit was being put together, it was the chief probation officers who were asked to go into their counties and get the teams and get them signed up and get you to all show up today. And I would say, based on a room that is still full on the second day after lunch, the chiefs did their job very well. So thank you to all the chiefs who got your teams here. And for all your teams staying. And I agree that as we go home, it really is upon us to help get the rest of our county engaged in this process of how we work with the mentally ill, taking back what we have seen here over the last 2 days, listening to the family members and those who have been through the system themselves, and remembering what they go through as we do our day-to-day. And so I think you have the support of all of us up here, but I would certainly like to say the chief probation officers are very much in support and will assist as we go home to help continue this initiative.
Is this very good? Again, my day job is working with the Shasta County Health and Human Services Agency as the Adult Services Director, but I'm up here today as a representative for the County Behavioral Health Directors Association, CBHDA, and certainly to both affirm and reaffirm our commitment in helping those with serious mental illness that come in contact with the criminal justice system. I'm hoping that through your discussions for the last day and a half, you've realized that behavioral health is absolutely a partner in this process, a willing partner, and is committed to the problem solving and the challenges coming at us. Our association meets annually in November to set its strategic goals for the following year. This year, last November, one of our top 5 goals was addressing the issue of criminal justice. So again, we are on board with helping this process go forward in a successful way. I feel a certain need to say we are also committed to trying to provide services ahead of time to divert people so that they never hit the criminal justice system, then to help the people who happen to run into the criminal justice system, and then we're also committed to helping all those individuals who are coming out of the jails, out of prisons, out of institutes for mental disease or state hospital, and again, scooping them up and trying to provide the necessary services so that they won't come in contact again. So thank you to the sponsors, and good luck.
For those of you who were here yesterday, there's not a bug on this microphone. We checked it first. So on behalf of the California State Association of Counties, I want to say what an amazing 2 days. I was half surprised not to find scalpers outside the room yesterday. And I don't know about the rest of you. We tried to get a few more team members to come with us. And we were told no many times. But so that says something about the interest level for sure. You know, CSAC represents 58 very diverse counties with populations ranging from just over 1,000 to over 10 million in the largest. And with few exceptions, we're all struggling with this. And I think having 53 counties here today and yesterday sends a very clear signal to the association that this is an issue we need to be very heavily involved in. And I think it's incumbent of CSAC to be part of the team that helps our family of counties learn how to implement what we've learned here in the last 2 days. And I wanted to, on a side note, I talked to a supervisor on the way up here, and she said, we've been talking. This is one of the best conferences we've ever been to. Everything was relevant. Everything kept our attention. We all stayed awake during lunch. I mean, and that was, we were talking data. So it shows that we've got a huge level of interest. And I'm really excited to be part of this. And what I'd say, one of the most important resources I've been taking home with me today, and I hope the rest of you do as well, are the phone numbers of most of the people in this room. It's on the app. I think the contact information is there, and I think we need to learn from each other. And when we get together next year at the summit that I just learned about, I think we'll have some amazing stories to tell. So, thank you for all being here, and just glad to be part of the process. So, thanks.